AIDS stands for acute immunodeficiency syndrome, but it can't catch it. It develops AIDS after becoming infected by a virus called HIV or human immunodeficiency virus. Once HIV gets into the body, it attacks the immune system. There the cells will be fight of diseases. Over the time, HIV get rid of all the good cells, so they can't protect the body anymore. With no defense, people can get really sick. When that happens, a person is said to have AIDS. Right now, there are 35 million people living with HIV, and 6,000 more get it every day. That almost 262 every hour, and 7 out of 10 of them lives in Africa.
Retrovirus that destroyed white blood cell helper T cells and causes the disease known as AIDS.
World Health Organization and United Nations Program on HIV or AIDS define three types of HIV epidemics: low level HIV epidemics, concentrated HIV epidemics, generalized HIV epidemics. Low level prevalence has not consistently exceeded 5% in any defined subpopulation. Concentrated prevalence is consistently over 5% in at least one defined subpopulation, but is below 1% in pregnant women. Generalized prevalence consistently over 1% in pregnant women.
Risk factors: unsafe sex, MSM, man having sex with man, migration and mobility, IDU, injection drug user, low status of woman, with spread stigma, incubation period. Current data suggests that the incubation period is uncertain, from a few months to 10 years or more. Virus can lie silent in the body for many years. Among the people infected with HIV, possibility 10 to 30% develop AIDS.
The 7 stages of life cycle: binding, fusion, reverse transcription, integration, replication, assembly, budding.
Signs and symptoms of HIV: fever, swollen lymph nodes, night sweats, mouth ulcer, fatigue, chills, muscle ache, rash. Main symptoms of AIDS include in neurological, encephalitis, meningitis; in eyes, retinitis; in lungs, pneumocytosis, pneumonia, tuberculosis, tumor; in skin, tumors; in gastrointestinal system, esophagitis, chronic diarrhea, tumors. Diagnostic tests for HIV infection include serological method for detection of antibody and antigen detection method. In serological method for detection of antibody, rapid test, ELISA, Western blot. In antigen detection method, P24 antigen capture test, polymerase chain reaction, also known as PCR or viral load. HIV emerges from latency. Symptoms include dry skin, chronic fatigue, fever, diarrhea, heavy height sweats, rapid weight loss, swollen lymph nodes, white spots on mouth, tongue, and throat.
Treatment with HIV medicines can prevent HIV from developing into AIDS. HIV treatment involves taking medicine that reduce the amount of HIV in your body. Treatment with antiretroviral drug is recommended for almost all the people with the HIV infection, because without treatment HIV infection can be serious complication. There is no effective cure for HIV, but with proper medical care you can control HIV. Most people can get the virus under control within 6 months. Taking HIV medicine does not prevent transmission of other sexually transmitted diseases. HIV medicine can cause side effects in some people. The most common side effects are nausea and vomiting, diarrhea, difficulty sleeping, dry mouth, headache, rash, dizziness, fatigue, and pain.
Always wear a condom. HIV is spread through blood, semen, pre-seminal fluid, vaginal fluid, and rectal fluid. You can get it through vaginal, oral, and anal sex. Condoms reduce the risk of the virus spreading. Get tested. 85% of Americans have never had an HIV test. The CDC recommends that everyone ages 13 to 64 be screened at least once. Talk about HIV status with your partner. Limiting your number of sexual partners can decrease your risk, but so can understanding the sexual history of your partners. Before having sex with someone new, ask if they have ever tested positive for HIV or another studies, and how many partners they had between those tests. Don't share needles. HIV can spread through blood. Injecting drugs with shared needles put you at risk. Consider preventive medications. People at high risk of contracting HIV might consider using a daily preventive medication called PrEP, which can help the virus from spreading. Tuberculosis, cytomegalovirus, candidiasis, cryptococcal meningitis, toxoplasmosis, cryptosporidiosis, progressive multifocal leukoencephalopathy, kidney disease, wasting syndrome, cardiovascular complications.
World AIDS Day is celebrated on 1st of December. Good health and good sense are life's two greatest blessings. When life gives you 100 reasons to cry, show life that you have 1,000 reasons to smile. Your future depends upon what you do today. So don't lose your life and stay away from AIDS.